So our first letter, we'll start with that, is from Norma. So Norma said, "Hi, my name is Norma. I'm 43 years old from Iowa." Hi, Norma. "I found out recently that I have cholangiocarcinoma. I've done a lot of tests and blood work, and they found out through my MRI that I have cholangiocarcinoma. I'm really devastated by this news as I'm still young and have kids to take care of. The doctor who diagnosed me with this informed me that surgery would not be an option. I think she's new to the hospital because she joined me having tests and we keep getting lost." Okay. Anyways, I continued insisting to hear about some options from the surgery team, but had no luck. Fast forward to today, and I want to explore some options. I know there are options and I don't want to lose hope. I have heard this type of cancer is rare and progresses very rapidly. Can you tell me more about private patient advocacy and how you can help with my condition?" So first of all, Norma, I'm very sorry to hear that. Thank you for sharing. It's difficult for me to read that because actually I have a family member that has cholangiocarcinoma, and fortunately through many efforts we are able to continue to work with him, and he's been managing it pretty well for the last 6 years, which is, not commonly heard. But yes, you're right. There are options. Getting a diagnosis like that is a very difficult one to hear, especially when it's a rare cancer like that. And you are correct. It's very fast paced. The good news is there's been a lot of advances in recent years on options for treatment as well as diagnosis. So there's some really great experts that really just specialize in cholangiocarcinoma, and I've really come to know some of them over the years. So I would, be very interested in reviewing your case, talking to you more to get some details, and really determining what additional considerations may be available for you. Please never hesitate to ask your questions to your healthcare provider, such as your doctor, regardless of whether they are an intern, an attending, an oncologist specialist. Ask your questions. If what you hear doesn't seem right, ask again and get more information and options. It may very well be that you're getting the same answer 2 or 3 times by by different healthcare providers, but that will just help you confirm that you're making the right decisions. But never, ever, ever feel nervous or apprehensive about asking a question. Healthcare providers each have their own way of practicing, and one doctor may have a different medication or a surgical technique that the other might not practice or might have not heard of. This is important when you're looking at a medical condition, but especially important when it comes to cancer. Nonetheless, a rare cancer or any rare condition. So we can definitely help you navigate and support you through this challenging journey. Thankfully, most recently, there have been wonderful advances in cholangiocarcinoma, and there are great resources available.